Welcome to the Menstruality Podcast, where we share inspiring conversations about the power of menstrual cycle awareness and conscious menopause. This podcast is brought to you by Red School, where we're training the menstruality leaders of the future. I'm your host, Sophie Jane Hardy, and I'll be joined often by Red School's founders, Alexandra and Shani, as well as an inspiring group of pioneers, activists, changemakers, and creatives to explore how you can unashamedly claim the power of the menstrual cycle to activate your unique form of leadership for yourself, your community, and the world. Hey, welcome back to the podcast. Thank you so much for joining us today. This is such a powerful conversation. I'm so glad you're here. So, in the UK, 24% of women and people who bleed suffer from chronic pelvic pain, and it's 1 in 5 in Australia, where our guest today, gynecologist Dr. Peta Wright, she's amazing. That's where she lives and works. So Dr. Peta Wright wrote her book, Healing Pelvic Pain, Transforming the Trauma of Period Pain, Endometriosis and Chronic Pelvic Distress, to explore a wide range of treatments which often aren't prescribed for chronic pelvic pain, including lifestyle changes, stress management, and particularly therapeutic work focusing on locating trauma in the body. Because over years of extensive research and working with women and menstruators with pelvic pain, she's seen a huge correlation between nervous system dysregulation and early childhood trauma and chronic stress, the kind of chronic stress that many of us experience in our cultures, and chronic pain. She says, as I began to see more and more women through this holistic lens, I realized that time, care, and love were just as important as drugs, surgery, and physiotherapy, if not more so. This is, in essence, the first part of establishing safety and stability for the traumatised nervous system, which nearly every patient with chronic pain has. And for me personally, as a woman who's lived with chronic pelvic and gut pain for many years, I learned so much from this conversation about pain, trauma, the nervous system, and a lot of which I'm going to be implementing in my life. So I'm so personally grateful. I hope it's inspiring for you. Let's get started with a trauma-informed approach to healing pelvic pain with Dr. Peta Wright. Thank you so much for being with us today, Peta. Reading this book, was very moved as a woman who's had chronic pain and thinking of all of the women and people in our community who experience pain and just how helpful this book is. And I'm really grateful to be in conversation with you, and we can see how we can tease open some of the amazing teachings specifically around, or particularly around, healing pelvic pain and trauma. I think it's huge. So thank you so much for making the time to be with us today.
Thank you so much for having me, and thank you for reading the book as well. It's always exciting when people have read the book, so thank you.
Yeah. So, well, let's start with a cycle check-in, like we always do. I'm on day 14, which means that being up at 4:30 in the morning is actually quite a delight.
Oh, goodness, yes. Oh, I'm glad.
I'm here in sort of summer solstice vibe, so it's very light already. And yeah, just feeling a lot of rising energy and feeling strong in myself. How about you? Where are you at in your cycle? How's it feeling?
I'm about day 2, so potentially the opposite of you. It's kind of, this is my day off where I'm not seeing patients clinically. So it kind of is quite nice that this is, that it's falling today. And also because we're coming up to the winter solstice in Australia, there's that lots of inward energy, those longer nights. And so I think it really suits having a period around the winter solstice, although the moon is also almost about to be full, which is a bit, probably suits you more.
Yeah.
But it is, yeah, it's really nice to be able to have that time where I'm able to do a bit more freely, rather than, sitting at a desk all day when I'm bleeding. So, yeah, and really nice to be talking about this. I have the first question be about that. That's so exciting. So thank you for asking. I wish I wish there were more conversations about it, and there was more. It was infused into our day-to-day language more. That would start to change the world.
Yes. Yeah, I often forget that not everyone does cycle check-ins at the start of every day. So sometimes
I
I'll be
know.
we drop off and I'll be talking about my period and people will be a bit baffled by me. So it's interesting. I was talking to Dr. Laura Owen. She's one of the early trailblazers of the menstrual cycle awareness movement. And she was talking about how what we were talking about was the menstrual cycle and menopause in the workplace and how wonderful it
Mhm.
would be if there was menstrual leave for everybody. So it just feels
Mhm.
very beautiful to feel you in your day off client work on your day two and how you're honoring that. And yeah, I
Mm.
think that's changing the world too. Yeah, and I also always love speaking to people when they're on their bleed because there's a sacredness to it. So, and that you're in the winter solstice on your bleed and I'm in the summer solstice ovulating feels very fun,
I know, very aligned.
very aligned. So I'd love to hear about what inspired you to write Healing Pelvic Pain. I know it's a big story, but if you could begin to walk us into that.
So I am a gynecologist and I was trained very conventionally. So I guess the way we're all trained in medical school and in gynecology, which weirdly, when I look back on it, you know, I read somewhere the other day that medicine is the study of disease and it's not really the study of health. Really, it's all about the pathology, and that was certainly my experience at medical school and in my specialty training, where we kind of learnt to view the body as the problems that women would come in with, always as a pathology that was intrinsic to the body of the woman. And all of the fixes were things that we did often with pharmaceuticals or surgeries. And I mean, like the backbone of our specialty is built on that, even the way in Australia we have Medicare, and the way that there are item numbers for surgeries, and but the item numbers or the amount that a patient gets back or the doctor gets paid from the government for consults, taking the time to listen to women, is actually very small, because the government kind of expects that our doctors would do lots of surgery, and that's where they earn their money, right? And so it's just really built on this, pathology and what we can do to women without educating them about their bodies, without teaching them about how their environment is absolutely critical in how things come up in their bodies, how their menstrual cycle is affected. Um, because often just by like teaching women about that, you can start to help heal a lot of their problems. So anyway, I was in this system, and being trained with, our training was pain, have to do a laparoscopy, have to look for endo or the pill, menstrual suppression of any type. And if we don't find endo, oh, okay, sorry, it's probably a gastro thing, like go and see a gastroenterologist, which is very unsatisfying for the patient. And it became incredibly unsatisfying for me because the more I did it and the more I actually listened to women, and especially when I started doing private work, so I would have more time and I would follow up my own patients, I would be like, this actually isn't working. This model isn't really working very well. And the more and more I spoke to women, there was similarities in their stories. There was a huge association, and this isn't the case for everybody, but the evidence bears this out. And it was certainly my experience in clinical practice that there's a huge correlation between, trauma is like a very broad word. Um, I would say nervous system dysregulation,
Yeah.
early childhood trauma, chronic stress, something that results in nervous system dysregulation and chronic pain, and which you can only tease out by giving someone the time to hear their story, right? And so the more I learned about this, and then the more I realized actually the surgery isn't really working very well. And often women are coming in not wanting to be on the hormonal things that they've been put on, and they're just feeling very confused and dissatisfied. And like there has to be another way. And I thought there's got to be another way. There's a route here that I can see that's coming up with so many for so many women. How can we start to acknowledge that? And when I first started learning about it, I was kind of very um, angry with them when I went back to the research and found, say, the ACEs research, like the adverse childhood events research that was done in the 90s, which showed that adverse childhood events and the more you have, the more it's correlated with adverse physical things in later life. And they could be anywhere from, we would expect, you'd expect mental health challenges, but pain, autoimmune disease, cancer, heart disease, so many things. And I remember reading it was like an opinion piece from the doctor who originally oversaw this study, saying that we are already kind of society has failed people who have had trauma, and we've not acknowledged it. But as medical professionals, if we continue to not acknowledge it, we're further traumatizing people and we're adding to their pain. And I was like, how come I never learned about this at medical school? And that was, in the 2000 and somethings, like 20 years after. So then I was in a position where I was seeing lots of people, trying to give them lots of time, but also working in it was a really male dominated gynae clinic, which seems like a weird thing, but it was. They were all men. And I thought, I I did some more training in like integrative medicine. I read lots of books. And this is also coming from a place where I was 36. I think I was 35 and a bit when I went off the pill. So I was on the pill for a really long time. And when people would say to me, oh, is it okay? Like mothers of teenagers would say, is it okay to go on the pill? And was taught from my mentors back when I was a junior trainee to say, yes, it's totally fine. Every gynecologist in the city who's smart, who's savvy, of course, why would you want a period? So of course we're all on the pill, and it's fine. And unless they're pregnant or breastfeeding,
Yeah.
and I would say this, and it makes me want to vomit now. And I went off the pill at like 35 and that was fortunate enough to fall pregnant, and then had my baby. And then I think then I was like, a veil was kind of lifted from my eyes too, with how I felt differently in my body. And yeah, and then I went down this track where I was like, everybody needs to know more about their body. I can't believe we're not teaching women about this, because if they knew how their body works, the things that can affect it, then there's so much they can do before then they're labeled with a pathology that they probably don't actually have, which then they need to identify with. And so I remember going to, do you know Lucy Peach?
I love Lucy. Yeah, we've interviewed her on the podcast. Yeah.
I was like seeing all of her stuff, and she was coming over to Brisbane, where I'm based, to do something. And I reached out to her and said, oh, would you like to collaborate? I think it would be so cool to do an event where we raise money for charity, and we also do like a big educational event, and I can talk about medical stuff and you can do your show, and it'll be really cool. And she was really down with it. And I remember I was so excited. And I remember going to the like all male board of the group that I worked in to say, this is like an amazing opportunity. Like we can do things really differently and start to really empower women rather than just be, you know, fixing their problems or telling them they're broken and then we can come to the rescue, right? And I had this whole presentation, and I remember sitting around this boardroom, and I was like right at the end of the boardroom table, and they all kind of looked at me like I was crazy.
Mm.
And and then I remember getting in my car afterwards and just like bursting into tears and being like, why? And then angry, like, why did I even think I had to ask permission to do that as like a 38-year-old woman who is a medical specialist in, and then I rang my friend who's a naturopath, and she said, screw it, let's do it together. And we did, and it was amazing. And we had these two incredible shows, one for younger girls and one for women. And it was just incredibly beautiful. And from there, I was like, this is the way I want to practice. Like, the heart of everything is teaching women what's right with their bodies, um, and how they can live more in alignment so that their bodies work well, and they're as healthy as they can be, rather than us all running around in this kind of very suboptimal place for our bodies to work. And then when it doesn't, feeling like we're broken and we're a failure. And then I left that old work and then created this place that's out in the hills outside of Brisbane, and it's in nature, and we have just an amazingly beautiful team, and we just do things in a really aligned, beautiful way. And I'm more aligned, so that shows, I think, to patients as well. So yeah, and then the book came out of basically just I guess the other thing is getting frustrated about, and I don't know what it's like in the UK, but while there is more awareness of the understanding of period pain and pelvic pain, and it seems like a controversial thing for me to even to say, but there's awareness, but it's all very, very simplistic, and it's all very focused on endometriosis as a lesion, and this kind of feeling that it all needs to be diagnosed early, and that means an early operation. But the problem with that is, from someone who has worked in this area and done those operations, and also seen those operations done by the best people, um, they don't they really treat the tip of the iceberg and sometimes make it worse, and especially if you're not addressing the other factors that contribute to pelvic pain. Um, it's it's it just is harmful, I think. And so that narrative, I think, I mean, if we think about it, over the course of the last, say, 30 years, I think, at least in Australia, pelvic pain and period pain has just risen exponentially. Um, I would say that the more women have been on the pill than ever, so to suppress periods and stuff, and yet still there is this increase in pain. And we've probably had more awareness about endometriosis and have done more surgeries than ever, and yet more and more women are suffering with pain. And so there is something wrong with the paradigm, and that's why I wrote the book, to try to teach women that about all the other things that are contributing to their pain, so that when they go down the conveyor belt of the conventional, "Oh, I've got pain, it must be endo, I have to have an operation," and then they're not better, they don't then think, "Oh my God, I must really be broken then, because even this, which is given to me as the thing that everyone should be having, hasn't fixed me." And it's much deeper than that, and it's more nuanced, and I don't think there's room or understanding of complexity in the media. And so I was kind of sick of seeing women 10 laparoscopies down the track feeling broken, that it was their identity, having no way out, feeling completely disempowered. And I just knew that there was a limited number of people that I could see one-on-one. And so I just really, really wanted to write this book to help give women the information to empower them, that they have choices and they have options, and that give them the knowledge and help them remember the knowledge that I think we all have in our bones.
Oh, it's so beautiful to hear you. And I feel your alignment, and you said, I'm here in Vera, it's called, isn't it? Vera Wellness in the countryside, and we're doing things in an aligned way. It's always just an honor and a gift for me to be with a woman who is fully in her calling. And I can feel it in you. And I have a question
Mm.
about that. But just first, there was a point in your book where you said flipping the script to one of such positivity may not be easy at first. And you're talking about moving from this fixing model to empowerment model.
Mm.
If you see your body as the enemy and have suffered immensely, you may want to throw this book at the wall right now. I don't blame you.
Mm.
Something in me, just when I read that, was just feeling so tender with the huge frustration of month after month after month, or maybe just consistently throughout the month, the pain that
Mm.
women and people who bleed are in. So it just feels important to say that to anyone listening that's like, oh, I'm in so much pain. I don't know how to do this. That you're, yeah, you're really with them, aren't you? You're really with them.
Yeah, and plus it's you don't come to this overnight, especially when we live in a culture that is so conditioned us from children before even like in the like people talk about generational trauma, like there's that we carry before we can't even verbalize how we know that, but such negativity about periods and cycles, and that this expectation that it's going to be, a hassle at best. There's no reverence for it.
Yes.
There's no acknowledgement or celebration for what the menstrual cycle is doing. As I say to the women that come and see me, the period, the bit that we see, the period is the end of the process of how we make our hormones, which is so important to our life force and our brain and our energy and our skin and our bones. And it's a product of that. And also, I think it's really hard when we live in a society that's so patriarchal and capitalist, where the model of success is seen as do, productivity at all costs, rest, and like that rest isn't seen as what we want to achieve, right? And I think I think we can all to some degree see that this model of society that is to the detriment of our society, our planet, our people. We see it in the lives of chronic stress that we live every day and how that impacts our natural world. And what I would love women to know is that we are not separate from nature. We are nature. And I think sometimes that's the very thing that is threatening to that patriarchal capitalist growth at all cost model, is that women's bodies, or the bodies of people who menstruate or have a cycle, um, have that it's not linear, and we mirror the cycles or seasons of nature every month. And just like we would never expect an apple tree to grow fruit every single day of its life, we see that there are seasons for that. And I think when we understand that, as people who have this cycle, rather than seeing the period as this hassle, because I think the thing is about pain, part of the reason I think we have so much pain is because we have to pretend that it's not happening, and we have to keep going. And if we could see it for what it is, which is this time of this downtime, this going inward, this resetting, this slower pace, I think there'd be way less women in my office. I think we have this huge advantage that we can reset and like follow those seasons of nature, which is so much more sustainable
Yes.
overall. My husband always says to me, "Oh, I wish I had a period that I could have like the time where I get to have my bath and, have you call me and say, can you bring me some chocolate and whatever." I think maybe all people have, we have so much to learn from the bodies of people who cycle and menstruate, that because they teach us about nature. And if we can realize that, um, and that power comes from that reset, that inner going inwards, then like that's hugely powerful to me.
Hugely. Yeah, Red School was really born from one of our co-founders, Alexandra,
Mm.
in immense pain, which suddenly came on when she was 30,
Yeah.
saying, okay, my body is speaking to me. I'm
Sending
going
me a message. That's right.
yeah, it's speaking to me, it's sending me a message. I'm going to listen. And she was a psychotherapist, so she was able to work her life around this, and she was
Mm.
able to take 1 or 2 days to fully rest and listen and be with her body. And it was that process of being with her body that led to all of the work and the naming of the inner seasons of the menstrual cycle, everything that's come from it. And she was also over time able to heal the pain.
Mm.
So
Because she turned towards it rather than tried to protect and resist it.
yes, yeah. And she was supported to do that by her
Mm.
specific culture that she was in. And I want to speak about women and pain specifically. There was a piece in your book where you said pain and suffering seem to have afflicted women since Eve. In our ancestral lineage as women, in our culture, and in the stories that have seeped into our veins, we have been conditioned to expect pain. There's something going on here, isn't there? And I also loved, oh, I love this bit where you went back and named, well, I think it's something like the history of pelvic pain. You have a whole section
Mm.
and you talk about all the male-led
Mm.
and then all the female healers throughout history, like Hildegard von Bingen and the
Mm.
ancient female healers in Egypt. And what's my question here? Yeah, can we speak about women in pain, really?
Yeah, I mean, I think there's a couple of things. I think, yeah, what you were talking about with Alexandra and the listening to pain as a message. Like, so there's a big Australian study that showed, like, with thousands of women, and it showed like something like 95% of women have experienced some pain or discomfort with their periods. And it's an inflammatory process. So I think as well, the thing about our lives and our humanness is that pain is an inevitable part of our lives. Suffering is less so, right? And I think that pain is amplified when, or the suffering that comes with pain, firstly, is amplified when we expect that we're not ever going to have any pain, or when we become so uncomfortable with any discomfort and so fearful of any discomfort, and we make no space for our bodies to feel different, right? Um, then anything that deviates from the normal state of our bodies is going to feel threatening and scary and fearful. And we know with pain, especially, that when we're fearful or stressed, our pain increases, because pain is a danger signal, and our brain will produce more pain and our body will respond in fear as well. If we're all crunched in and immobile and breathing up in our chest rather than in our belly, we have more fear. And then combined with the fear of, like, the fear narrative of endometriosis, and you have to have a surgery or it's going to, like, ravage your insides and cause everybody infertility, which also increases fear and then pain. So I think that if we think about the experience of pain or discomfort with a period is a common thing, whether or not, if we lived in a different world in which we all were allowed to have 2 days off or work from home or lie down or acknowledge that we're having a period, that probably would be less, I think. I think I think that our modern lifestyles exacerbate and make that experience of pain generally far more common. Um, but and I think that if we were allowed to do that, it would be better. But we also have to think it's a message from our body, right? It's telling us, if so many women have that message, we have to listen to it rather than ignore it, because we know that when we resist something, it persists. If we protect against pain, it will, like, keep knocking on the door saying, hey, you're not listening, you're not listening. And then much of the way our body and our mind responds with that resistance, because it's like, I'm resisting this thing, it's got to be dangerous, therefore it's going to be more painful. So I really feel like we have to listen to it as a message and think, just like Alex did, what do I need to do? What do I need to change in my life to honor my body and my cycles? And I think that would help a lot of women, firstly.
Yeah. And what do we need to change in the world? The structure that we need to change in the world to make it available for everybody to do that. Yes, 100%.
Yeah, and also I think it's infuriating when people say, well, it's ridiculous. The economy would go to its knees if everyone had menstrual leave. I mean, but that's perhaps what needs to happen, and probably it wouldn't. And I also feel so annoyed when anyone ever talks about the problem of period pain as in days of lost productivity and, like, the cost of lost work. I mean, I just think it's through such a capitalistic, ridiculous lens, that when you think about, and all of the surgeries that are often unhelpful, that if we think, okay, well, maybe if we just stopped women having to fight against what's happening in their bodies and to learn how to go with that flow rather than against it, then there's probably going to be way less operations, way more productive time because women know how to care for themselves, or if they're working from home and just being able to care for themselves better, they're probably actually being more productive, to be quite honest, or they're having a rest and then they're going to be more productive on days 5 and 6. So and we're 50% of the population. Like, why shouldn't our needs be considered?
I'm going to pause the conversation with Peta for just a moment to share an invitation. If you're feeling called to connect to your menstrual cycle more deeply, either because of pain or other health symptoms, or because of an inner knowing about the power and authority, creativity, and meaning that lies within this ebb and flow of the cycle, we'd love to invite you to join our Menstruality Leadership Program. We're starting in February next year in 2025, and we're hosting a free introductory webinar on July the 24th, all about the program. You can register for the webinar and find out all about the training, the curriculum, hear stories from our graduates at menstrualityleadership.com. On the MLP, you'll be held by Shani and Alexandra and this amazing community of cycle, passionate, inspiring, brilliant people that gather every year for the program to understand how to harness the real depths of the practice of menstrual cycle awareness, or cycle awareness post-menopause, as your personal, tailor-made spiritual path to experiencing more wholeness, safety, vitality, power, peace. So good. You can find out more and register for the program and for the free webinar at menstrualityleadership.com. Just so many times in my life as a woman and in this work, it comes back to I think, therefore I am. This moment, Descartes, when the mind and the body were split, and then that ripples out across history, religious, philosophical. It's the water that we're swimming in.
Yes.
It's never made sense to me. And I loved when I read from Eve Ensler, who wrote the Vagina Monologues, I feel, therefore I am.
Yes.
Always has just stayed with me as truth in my body. Yeah, you talk about the mind-body bridge is the nervous system.
Yeah, and I think that's important to talk about because what I see happening, and it's very complicated to tease out.
Yeah.
But what I see happening is that because women's pain, and when I say pain, I don't just mean physical pain, because I think physical pain is often a representation of uh, pain at the soul level. That's what I think. And that's how it comes up. And I think that for so long, women's pain, oppression, etc., has been dismissed. And with the mind-body dualism thing of, well, you've got pain, and then if we can, with it, it's such a, I mean, it really is a very simplistic model of thinking about things now that we understand the complexity of the human body, but to say, well, okay, well then let's look inside that part of your body, and if we can see something, which, by the way, we don't even know if, say, some bits of endometriosis might not be part of a normally menstruating person, and there are lots of people, including me, who thinks that part of it may be physiological. You know, even the French guidelines would say that endometriosis is not always a pathological process. But if we have the model of, okay, well, you've got pain, we're going to look inside you, and the model of what's real is held up as a physical thing that we can see that's in the body, and we disregard anything that has to do with the mind or the spirit, which is what that whole mind-body dualism is about, and we say that's not real. And people who deal in that, they're like the healers and the witches and whatever, and we are a very serious authority, and we only deal with what we can see with our eyes. which was the establishment of the modern medical system, which was all often men at the very beginning, and discrediting a lot of what healers and midwives and things were the kind of work they were doing. But so if we're in this culture of only that is real, then women who have pain and want care and validation will want that diagnosis and that treatment, because that's the only way in this model their pain and their trauma can be validated. Does that make sense?
Totally.
So we then get into this position where women are, it's almost, the tears I've seen in recovery rooms when women have had an operation and not had endometriosis found, which, by the way, it's like 6 out of 10 is the number of women who don't have endometriosis who have a laparoscopy. So 6 out of 10 people have pelvic pain and don't have endo. So there are other things going on. And even for the ones that do have endo, there's still probably those other things going on too. We have become like, I understand women's need to have that because that's the only way they've been able to get treatment. And if they don't have it, then they're told, oh, it's in your head, or completely discredited, not validated, not given any help whatsoever. And I think, I think that the continued upholding of this model, it fails both women who have been diagnosed with endometriosis, because they often don't get better with that model if we're just focused on the lesion. And it also fails the 6 out of 10 women who don't have endometriosis, because then they're told they're crazy and there's nothing there. So when we understand that the mind and the body are not separate, in fact, the nervous system is, like a bridge. Well, it's not even, I mean, I use the word bridge, but I would say that it's all one, comprising our central nervous system, our peripheral nervous system, our autonomic nervous system, which is the oldest part of our nervous system that kind of controls our breathing, our heart rate, our digestion. It's a bridge to the environment as well. So it's always checking, are we safe in the environment? And so that's where what happens to us matters, because what happens to us in the external environment, or what we perceive as danger, alchemizes into our body, it changes our physiology to help us survive, which is really clever. Except that if we stay stuck in a survival state, which is like, we might have heard of fight or flight or freeze, in a concept called polyvagal theory, we talk about the sympathetic nervous system, where we have lots of cortisol and adrenaline. We might feel more anxious and angry and irritable and just can't settle, more stressed. And we talk about the dorsal vagal, or the freeze state, where everything's just so overwhelming that you just can't. And both of those states are survival states where our body is perceiving danger, whether there is real danger or not. And in those states, I love to explain to people, it's not just how we physically feel, but it actually changes our body. So it changes our microbiome and the bacteria in our gut. It makes our gut more leaky. It leads to more immune dysregulation. It leads to more inflammation. It changes our brain. And if our brain is in a survival state, it's like it's like a dial is turned up to 100 in terms of sensitivity to picking up more danger. So we might be more reactive to things that happen externally, but also more reactive to things that happen internally. So there's a word called interoception, and it means that it's the way we interpret internal sensations. So things that might be painful, like potentially painful, like a period, like ovulation, things that are inflammatory in nature, can become even more so, because that dial is turned up to like 100. Things that are non-painful can become painful. So people who have real chronic pain, who start to have pain every day, might have, pain everywhere in their body, or even like if you touch their skin, they might have pain. So it's this turning up of the danger signals, which increases pain and changes our brain. And yeah, it changes everything. So if you understand, and there's a big word for that, which is scientific, which I think helps people who also need to understand the science or whatever. It's called psychoneuroimmunology, which explains that our brain, what happens in our brain, our immune system, our thoughts, beliefs, conditioning, even, and we can add another bit of the word that means our hormones, our endocrine system. It's all connected, and it can't, like, we don't operate like in a bubble or a vacuum. Our nervous system responds to what's going on around us. So that's where that piece of what happened, who was there for you, were you able to understand or become aware of your own nervous system and be able to tether back to safety, becomes really important. And people can have awful things happen to them, but if they had an ability to process it, to go back to their bodies, to find safety in their bodies, then often those effects aren't lasting. But if they've had no way to understand what's happening to their bodies and be able to return to safety, or had someone to help bring them back there, which is so many people in our society, you can get stuck in those states, and then that's where a lot of disease happens. So not just chronic pelvic pain, but many other things. But it's something I see. I would say 100% with chronic pelvic pain would have dysregulated nervous systems, and and then with period pain itself, I think a lot of the same things feed that. And so there's so much promise in that, because when women understand that, and then they can also understand, if I can explain to them, like, okay, well, so when you get that pain with your period, what are you thinking? What are the thoughts in your head? Like, are you afraid? Are you like thinking about a painful time in the past? Are you anticipating a painful time in the future, or scared that it won't stop, or anticipating it to be painful? Because pain is a subjective experience, and it is born out not just of like a physical stimulus. So, for example, with a period, the inflammation and the contraction of the muscle, and the hormonal changes, but it's born out of our past experiences, what we expect, our fear, our cultural conditioning, the levels of stress, like how we're able to care for ourselves. So many things go into the construction in the brain of how painful something will actually be. And there's a thing called predictive coding, which is like a neuroscience term when you start to understand the neuroscience of pain, is that because our brains have got so much stuff to have to contend with and process every day, it's like starts to make shortcuts. And predictive coding is the term used to describe the shortcuts our brain can make, which may not be representative of the actual painful stimulus that's in front of you right then and there, but it's that culmination of all those other things I just talked about. So when we understand that pain isn't as simple as damage, danger, something terrible is going on, and it is all of those things, then it's great, because we can start to work on all of those things, which are very changeable, because our bodies have changed to help to protect us. That's what our body is trying to do with pain. It's trying to protect us. But if we can help to teach our bodies that we're safe, then we can retrain our bodies into a place of safety where pain is going to be far less likely. And surgery doesn't do that. And drugs don't do that, although they can certainly be part of the picture, but it's just so important to have that as the foundation, I believe. And I feel like women who may have previously been like, when you don't understand that, it's like, of course, the only way I can get validated is with a surgery. But when I speak to women and I explain all of that, they're like, oh, okay, this makes sense. And I can see that you're validating me because you're letting me tell my story. You're telling me that my pain is real. You're listening to me, and you don't need to do an operation to validate that. Because whether or not there's endo there, your pain is real and your story is valid. And also, we're also exploring the roots of it, which might have nothing to do with that physical expression of pain. It might be, and very commonly is stuff like complex trauma in their childhood that they've never recognized. It might be sexual trauma that no one's ever been able to give them a place or a space to discuss. and the work also isn't like delving in and like re-traumatizing with this stuff, but it's like just putting the putting the pieces together, joining the dots, so women can start to see that kind of timeline of how their bodies have gone into that survival state to protect themselves, which is a really beautiful thing for their bodies to do. And I think from that place, not only can they understand how they got there, understand the tools that can get them out, but also have deep compassion for their bodies, which adapted so beautifully to help them survive in a period of time which they perceived to be dangerous, and that their bodies are not broken. Their bodies are amazing, and just responding to the environment exactly the way they're supposed to. And then we can go about trying to change the environment. Sorry, that was a long answer.
Don't apologize. That was wonderful. I knew this was going to be a good conversation, but I didn't realize just how good. But yeah, you're really speaking to the past 15 years of my life because I've had chronic pain, pelvic and gut. Well, it gut, but like reading your book, I was like, hey, it is in my pelvis. It's like even that haven't really been able to locate it necessarily. Um, but the amount of gaslighting that's gone on because I've never really gone down the route of trying to understand because of all the reasons you're saying of trying to understand what the pain is. And when I say that, I mean no one has like looked inside my body to understand it.
Mm-hmm. Mm-hmm.
Um, and because of that, I've never had a thing to say to people like I have XYZ. I've just been in chronic pain.
You know, chronic pelvic pain is a diagnosis unto itself as well.
Mm.
You
Mm.
can so we can say I have chronic pelvic pain,
Yeah,
because I think that's what a lot of people who say who have had a laparoscopy, and the only language we have to talk about it or to give that validation is endo. But if you don't have that, they're like completely not validated, and it's like, well, what do I say? And it's your experience is chronic pelvic pain, and that is, I mean, I'm not a massive diagnosis fan, but but that is your experience. Like your experience is, I experience chronic pelvic pain, and that's a very valid thing.
for sure. But when you go out in the world, and the same with IBS, oh, it's just IBS. It doesn't just feel like freaking IBS. It freaking hurts.
Mm.
It's changed my life
Mhm.
profoundly. The way I'm able to work, the way I'm able to move, what I'm able to do. And when you speak about danger and safety, it's like just slowly over time, because I've been blessed to be supported by lots of people. I've just seen, oh, my body feels like it's in danger most of the time. And
Mhm.
yeah, I just feel like I've just been a decade of finding safety.
Mhm.
And beautifully, although there is a little bit of pain now, that I've made lots of lifestyle changes that I'm very privileged to be able to make. And it's very minimal how it impacts my life now. But I wish I had heard this conversation 12 years ago because the amount of validation of my experience, of honoring of my experience, and then gateways of possibility for changing my experience. I'm just so glad that we're having this conversation now and that people listening can, yeah, feel the hope that is here and the possibility that's here.
I'm glad you were supported to help you to realize that that sense of safety impacted your symptoms. And but I often see women who again have had that IBS diagnosis, and their only treatment is, because it isn't like a thing that you can see, uh, is the ridiculously restrictive diets. And often then it kind of heightens that anxiety or that nervous system dysfunction, because there's so much preoccupation with the food and then how it's going to affect the gut. And I like love the work of, and I don't know if you do, say the gut directed hypnotherapy. Have you heard
Mm,
of that?
not really. No, tell me about it.
So it works on the premise of the mind body, like the vagal nerve connection. So the vagus nerves, for people listening, so they're big nerves that come down from the back of our neck and down to our lungs, heart, gut, actually all the way down to our cervix. And takes lots of cues from our body to our brain of safety, or danger. So about 80% of the messages go from our body to our brain up the vagus nerve, and there's a big, huge connection with the gut. And so that's often why when we're feeling nervous or anxious or something happens, we feel sick or we have tummy pain or we feel butterflies or whatever. And also when we think about being in that fight or flight or freeze states, that effect on the gut microbiome, on gut motility, because our brain's like, well, I'm in danger, I don't need that. And so digestion's massively affected. So so there was a group of researchers. They were at Cambridge or Oxford, somewhere clever. I can't remember which one. And they came up with this gut-related hypnotherapy and found that basically you're not hypnotizing the gut, but you're working with mindfulness, with breath. So that's like what we would talk about when we talk about integrated therapy with our body and our mind and our nervous system. That would be bottom up. So helping us to establish cues of safety, safe messages to go up our vagus nerve to our brain. So breath, posture, those kinds of things. And then like self-talk, which is, top-down therapy about safety. And they found that when they did that with people over a period of time, they had 80% decrease in symptoms or improvement in symptoms, which was comparable to people on like a really restricted low FODMAP diet, but without doing the restricted eating, which is amazing.
That would be amazing because my diet is hugely restricted and I just live inside it now. And it's yeah, that's great to hear. Okay.
There's an app. There's an app called Nerva, Nerva, and it's excellent. So I've had patients who have had both IBS and pelvic pain, who've gone away and done that, and also maybe seen a physio or something, who've come back and just said their pain was so much better, and they've actually been able to introduce foods that they previously thought they could never eat again. So I think because that is really working on that nervous system, the nervous system root. So it's really a good thing to do.
I see it very simply because I'm very lucky to have a sister-in-law that lives in France. When I'm on holiday with her, I can
Mm.
eat a chocolate eclair and it doesn't
Mm,
like I don't have the same symptoms. I'm like, oh, I'm not I'm relaxed. I'm not in this like
mm.
do productivity mode. So I'm gonna get that app. Thank you. That's really helpful.
Yeah, it's really good.
I'm so grateful for this podcast as my like own personal therapy.
That's when you know you're doing something important. If it benefits you, you know it's going to benefit other people.
Yeah, yeah, for sure. Yeah. I guess just to summarize this piece around trauma, with what we're really talking about is establishing safety.
I think that people often think, oh, I don't have trauma. And I think if you go looking for like capital T traumas or whatever, it's not about that. It's about being able to figure out if someone's been able to embody be in their bodies, whether they've felt safe in their bodies, so if you're not living a life authentic to you, that's also kind of I feel I would say I would use the word trauma and I would define it as things that happen either as a single event or continuously to bring you into a state of nervous system dysregulation. That's how I would, and it can be, and like I think about women as a collective, and I think Gabor Mate says, women are the shock absorbers of society, and women at the most basic level are not able to live authentically because we have to pretend, and in fact, not even pretend. Most women are so unaware of the fact that we have those four distinct parts of our cycle, but we have to pretend that we're either kind of at ovulatory energy or like early luteal energy, because the rest of it is unacceptable to society. Um, and that linear way is just the way. And so we kind of operate just even from that very basic biological lens in an inauthentic state.
And I think it's really important to add too that for Black women, for women of color, there's that next level of whiteness is also the kind of the standard. And so to
Yes.
deviate from whiteness is the next levels of burden and pressure and obstacles.
Totally, exactly. And so I would, yeah, exactly add that. So if you're a person of color, um, if there's poverty, if there's any of those other things, there are further layers of uh, where you're not really, where your experience isn't really honored and you're not being able to be authentic. And so that's in itself difficult. And you know, there's so much, but when I talk to women, there's often way more than that. And I just think, like, this is why I think this work is so important. I think menstrual cycle awareness is so important because it's from that most basic level teaching people with cycles that they don't have to pretend, gives them the knowledge that they can have that awareness. Because, gosh, the people who come and say to me, oh, they'll describe to me a perfect menstrual cycle. I have this thing, and like at ovulation, at this point, I have like a bit more bloating and I feel like a bit more energy. And then about 4 days before my period, gosh, I get a bit more like I want to be alone and I get a bit more crampy. And I'm like, yeah, you're just describing them, but they don't have any idea about the correlation, right? So they think, again, something is wrong with me. And especially, say, women who've been on the pill for a long period of time, they go off it. And then they're like, why isn't my body the same all of the time? And there's that, it's just almost like, I don't know if it's the right. We've got this beautiful Indigenous doctor here, and she talks about colonization, but she talks about not just or decolonization. She talks about, you know, of course, we can talk about it in the ways that we often do, but we can talk about it also in terms of how women are conditioned in their lives and their cycles, and like giving them the information about what's actually going on in their bodies so that we can start to honor our own cycles. That's also kind of a process of decolonization, which I think is like super interesting. Um, and yeah, I just think it's so powerful because if you can start to realize your body isn't broken, yeah, it's different to that male standard, but that isn't less than, it's not weaker, it's not less powerful. Then you just operate on a whole different energy system. And I know that if people are listening to this and they're like, well, I've got 2 jobs and I cannot take a day off for my period. And that, like, well, obviously what we're wanting is system-wide change to enable that to be possible for everybody. But also there are simple things that you can start to do. And I would say just like being aware of it in yourself, talking about it with your family, even if you are doing like the caring at home and the other job outside of the house, just talking about it with your family so that there is that language around it, because that changes culture. Um, I have this cool app called Stardust, which we really like at Vera, which it's like a menstrual tracking thing, but it tees you up with the moon, and it's got these really cool features where you can add other people, like so all of the people that work here, my stepdaughter is all on mine. And then you can like nudge your partner or whoever you want to and like cast them a spell where it says, hey, I've like day 28, bring me home some chocolate and clean the house. And
I love
I
that.
know, it's so cool. It's really, really cool. It's called Stardust. I have no affiliation with them whatsoever. I just love their app. But that starts to change culture, and like even just small things like taking a moment to rest, having a bath, telling your kids that they can do dinner or getting something out of the freezer, taking yourself off to bed early. Just those simple things can start to change the way you feel inside. And then I think from a larger trauma point of view, we have to start acknowledging in society that so many things, not just pelvic pain, have their root in the lack of support that parents have, and the again, no reverence for family life and parenting and childhood. And you know, the way even mothers who stay at home or parents who stay at home are kind of seen as or not paid, not seen as a valuable thing when it's such a valuable thing. Um, and the lack of support, which often then leads to that traumatic stuff. And there's that generational trauma. It's not like anyone's going out of their way to hurt young people, but it's just this um, lack of awareness about that really vulnerable time in children's lives, and helping to support parents. And there's really good research that if you support parents in that early childhood stage, then you can actually reduce a lot of these things later on. There's some really good research from the States on that. So we need to have that awareness, and like bring in awareness about the nervous system into schools, so that even if people have suffered with stuff, they can start to have that insight into where they are and start to learn tools to bring themselves back to safety, even if they're in a challenging place. Like that kind of language is also really important, I think.
100%. Thank you, Peter. I mean, this has been really supportive for me personally, and I know it will be for so many of our listeners. How can our listeners connect with you and your work?
They can find our website, which is verawellness.com.au. They can find my book, which is Healing Pelvic Pain. I think you can buy it on all online, Amazon, etc. We will have a podcast ourselves, actually, which I'm about to go and do the second episode of, which will be released in August, and it's called Women of the Well.
Mm.
And we're also developing some online resources for women with pelvic pain. So there'll be Healing Pelvic Pain online resources and courses, which will also be available from August. So you'll be able to find that on our Vera website.
Amazing. Thank you so, so much. This is like the best way to start my day. I really, really
Oh,
appreciate
I'm
everything you do. Thank you, Peter. Thank you.
no problem. Thank you. Have a beautiful day.
Bye. Oh, wow. That was incredible. I learned so, so much from Peter. It was definitely worth getting up at 4:30 in the morning for. What an amazing conversation. I'd love to hear your takeaways, how it was for you. You can always tag us on social media at red.school or me at sophie.jane.hardy. Or you could write to me, sophie@redschool.net. Always love hearing from you. Would love to hear who you'd like us to be talking to, what topics you'd like to be exploring. We really want this to be a conversation. And if you know anybody who is suffering from pelvic pain, please do forward this episode to them so they can benefit from Peter's brilliant advice. Okay, that's it for this week. I'll be with you again next week. And until then, keep living life according to your own brilliant rhythm.